Okay, it's Dr. Richard Barwell coming to you with the BrainTrust and Neurofeedback Chiropractic Equity Offices programs of the BrainTrust Group, which is just so much fun to be interviewing these guys and ladies. It's just been a joy. This is number 7, and Dr. Pat Keiran and I go back quite a long ways and had some great experiences together, especially going out to Logan and nurturing, and he has been just absolutely incredible about nurturing and helping chiropractors get started. I want to salute you for that, Dr. Keiran. You've got a heart as big as the profession, and people need to know this, that you've been, it goes on and on and on with people that are in our group that you keep reaching out and helping. So from my heart, I say thank you.
Thank you. That was great.
It's my pleasure. Then we have you stuck up in snow country, up in Maine.
Mm-hmm. It's going to be 65 tomorrow, though.
I can't hear your speaker. It's not very loud there. I don't know if it's
let me turn it up.
Just a wee bit.
Is that better?
Yeah, that's better.
Okay, good.
All right, well, let's get started. Where did you graduate from, and how many years in practice?
So I graduated from, I still call it Logan College of Chiropractic, even though they've taken the chiropractic out of the name and the curriculum. I graduated in August of '96, so I've been practicing for about 21 years. I did about 8 years in Massachusetts and the rest in Maine.
And the rest in Maine?
Yep.
And how's that been going in Maine? Like, what size community are you in Maine?
There's about 4,500 people in our town, and it's geographically fairly big. It's a paper mill community, and so there's 3 employers: the school system, the town office, and the paper mill. But we've really had a great run here, and I wouldn't change it for anything. Great place to be.
I've had the pleasure of coming up and being in your practice, and it was a wonderful time up there. And I love the small town practice. That's sort of my heart anyway. So it was like going home in a lot of ways.
I know, and it's been 5 years, and people still quote you that went to that dinner talk. So you left a lasting legacy with people up here, which is pretty cool.
Well, they're my kind of peeps.
Mm-hmm.
Sure. So prior to running across neurologically based chiropractic, what practice model did you use in your practice?
So I always felt like I was neurologically based. I was very attracted to Thompson technique when I was at Logan. That was my technique of choice. It's interesting, I use instrument adjusting now, but I took activator right at the end of Logan because I had to. And I said, well, I guess it's okay. Maybe I'll use it on like babies and old people. And but Thompson was my primary technique, and I was drawn to it because it felt more neurological to me. The leg checks and the evaluation seemed a step up from palpation to me. So really, that's the model that I did, and I felt like I was practicing neurologically because I used an earlier iteration, so to speak, of a little part of your technology, measuring surface EMG and doing thermal scans. And so I really felt like I was neurologically based. So it was a little bit of a kick in the teeth when I saw that I wasn't, and I could do a lot better. So.
Wow. Did that ever raise any questions along the way with practice about what chiropractic was really doing with that? You know, we still have the concepts of vertebral subluxation as the foundation for chiropractic. Were you ever challenged with that?
I was, and I was really stuck in a model, you know, especially like thinking about the sacrum and pelvic adjusting with Logan Basic and Thompson. You know, I knew that I felt in my heart that there was more neurology in the rest of the body than we were aware of. But what I didn't realize was that physiology that I was reading with other techniques was a result. There weren't subluxations there. The subluxation was brain to the rest of the body, and what I was reading was the sequelae from that, and not actually the primary subluxation. So that was a huge awakening for me when I started to hear you. I think for the first time, probably about 8 or 9 years ago, at the Master Circle.
So, you know, that's just a part that comes up a lot in discussions that I have and on Facebook and email and et cetera with chiropractors out there. And when I speak, is that's a major step. There's a how did you deal with that shifting of your concept of what chiropractic was?
Avoidance is probably the way I dealt with it. You know, and you've heard this before. Like the first time I saw you, I knew, you know, I had been using the subluxation station for years. I felt like I was measuring neurological function, and I included the brain in that, and knew there was something profound there. But I was comfortable in my own stuff. My practice was good, and I was getting good results, great results. But as always, like you can always obviously do better. And so I never like would engage with you or Dee Dee at conferences. I would kind of walk around, so I didn't have to get. And you know, it's funny you talk about what I've done for students. It's ironic. There's actually a preceptor doctor coming from Logan to spend some time with us, who's arriving today. But it was actually students at a KST seminar who were very drawn by your message, as much as I was. However, they went and got scanned, and they all, especially my lovely redheaded stepchild, said, "Why don't you do this?" And so I had all my defensive reasons why I didn't, but finally begrudgingly got scanned, and then as fate would have it, I've told this story to many people before, but we were at another KST seminar, the very next one, and I did get a scan, and I thought it was kind of neat, and it seems like a lot of work, and so then I just got distracted because it was also a little bit of a work weekend at the KST seminar, and about 40 of us were going out to dinner, and somehow I got stuck into another NeuroInfiniti doc, Greg Schwartz. I'm stuck in his Honda Civic, sitting in between you and Dee Dee. And I'm like, I think the universe is trying to tell me something here. But like one of the most profound moments, and I had heard and was drawn to NBC for a long time. But Dee Dee was asking me what I did in practice, and then she looked at me in that car and she's like, "So tell me exactly how you're measuring the brain." And I just kind of, so that was my moment, and I've tried my best for people that are kicking the tires on it to remind them that there is no technology like this, and there is no model like this, and get over themselves, because you're gonna serve at a much higher level if you get into this work.
Well, I know that you've been involved in other programs, practice management programs, and I just want to touch on that just a wee bit about, there's people out there that are struggling in practice and think that they can do it on their own, and they have some problems. What's your recommendations when it comes to coaching?
When I have found that really, whether it's been formal or whether I've had mentors, that coaching is always essential for me. It's very important to find a group or an individual that you resonate with. And the coaching piece was very helpful, but I think you also need to find a coach who understands neurologically based chiropractic, because this really is a new model, even though it's been around for a while. And there's some really great coaches out there who don't understand where we're coming from. And you really need to, and honestly, this is a bit like a coaching program too. The coaching history that I got from you has been profound, and how you worked in practice before NeuroInfiniti, and then the changes you've seen when you're coaching people on using NeuroInfiniti. So I hope that answered the question, but I think having a coach is essential. But it's super important that it's a coach that understands neurologically based chiropractic, because a lot of them are very stuck on vertebral subluxation, because it's worked for them for 30 years, they feel. A lot of them are stuck into the 3 times a week, twice a week, once a week model, and aren't using any sort of scientific information from the brain to choose their frequency of care or their intensity of care. So
I think that's a great answer, and that's one of the things that I found when I finally gave in and realized that maybe I could learn something from somebody else. It took a long time to swallow that ego level, that they opened up possibilities that I wasn't considering,
Mhm.
And whether I acted on those possibilities or not was a secondary thing, but it was like, wait a minute, maybe there are other things I need to learn and to know about putting this on. And your point about, and boy, this just drives me crazy, because the neurological approach is finally caught on. And that was my goal from day one, was to move the chiropractic profession from structural to neurological. Now we see a whole bunch of people out there claiming what their technique is or what their program is. It's all, brain based, but they have no way of measuring it. They just,
Exactly.
because they get results, they make that assumption, as chiropractors tend to do. So your points are well taken, and that's a perfect answer to that question.
And I hope that people hear the point that you just made, because I do see a lot of people out there that are saying they're doing neurologically based chiropractic, and they may be moving toward neurologically based chiropractic, but if you're not measuring the brain when you start, if you're not using the information that you get from a stress response evaluation, and then checking in from time to time to make sure you're delivering on the promise, then I don't get it. I really don't understand how you can do neurologically based chiropractic without the NeuroInfiniti.
What instrumentation do you use in your office
Uh,
besides the NeuroInfiniti?
so I also use BrainTap. I found that that's been really beneficial for, when with KST we get really great results, and we see that on follow-up exams. You've seen a lot of our pre and posts. But as always, just with physical, chemical, and emotional stress, it can be really tough to get people's theta. That's usually the last thing in my office that I see the need to increase. And BrainTap has been huge. And from learning from you that it's the brain is the most plastic, the most able to shift for 20 minutes after an adjustment, and to not send people out into the crazy world immediately when they're done getting adjusted, and to have them brain tap right after is really important to me. And and I think I've heard you use this analogy a lot, that the adjustment is like jet fuel. The pattern interruption really creates a huge impact on the brain, but something needs to keep the patient in the air in between visits. So any sort of self-care with BrainTap, essential oils, nutrition, is also a critical piece in neurologically based office.
And you're using KST and Keiran specific technique. We know we've done a lot of research with Ted, and you were involved with it, and we've seen just some amazing results. We see great results with a lot of approaches. I really happen to like Ted's approach and what he does. That's one of them that I recommend.
Great.
I'm getting a little feedback now. So I know that he uses the ArthroStem as well. So you're using the ArthroStem in your adjusting?
Yes, I use the ArthroStem. And the great thing about the ArthroStem is, based on the scan, I know how much pressure. I've got the frequency switch on the ArthroStem, so I'm able to change it from 6 hertz to 12. You still getting feedback?
No, it's okay.
Oh, okay. So I've found that the ArthroStem is an amazing match to the stress response evaluation, and that was a really hard transition for me too, because I had 2 Thompson tables on either side of a half wall, and it was like playing the piano all day. I absolutely loved Thompson adjusting, so I had a hard time wrapping my head around the instrument. But it's amazing when you get the information from the occipital drop, from the NeuroInfiniti, and use that light force, use that specificity with the ArthroStem. It's amazing what happens. And
as you know, I love the adjustable hertz frequency of input into that nervous system that you get with the ArthroStem. So it's one of them that I really do recommend.
Right.
What would say your biggest challenge about bringing the NeuroInfiniti into your office?
I think probably my own mindset was. There were 2 things: the structural, as far as flow goes. I was worried that it was going to take too much time to do the scan, and how am I going to figure out and do rescans on people that have had the old technology, and whatever. And that turned out to be a no-brainer for me, because you remember Sarah, who was our NeuroInfiniti expert in the office. She was a rock star, so I was able to pretty much unplug substation and plug the NeuroInfiniti in. So we worked really hard, and we had a really great flow as far as office flow went with integrating NeuroInfiniti. The other big problem for me was mindset and feeling like I wasn't going to be able to appropriately explain the scan to people. And I just thought, there's no way people are going to understand it, and how much do I have to share? How much do I not have to share? And very luckily for me, we did some scans wrong, a few of them, before we came to the first training. And I can't believe I still encounter people that have NIs that haven't been to a training, and they're so critical to get there with your team, to many of them. But we went to our training shortly thereafter, and I remember I explained the scan exactly the way you told me to in the training. And the first patient, when I came back, was a very typical chiropractic case. She was a runner that injured her knee and her right SI joint. And at the end of explaining the SRE to her, she said, "That's great and everything, but I can tell I really need to bring my daughter in. She's 6, and her teachers want to put her on medications." And so right away, because I was smart enough to say what you say, patients understood it. And maybe that was a very lucky thing for me too, because I knew right then from that very first interaction that people did understand it and that it resonated with them, and it was going to really be able to shift people from pain to the brain.
How long does it take you to do the scan, and how long does it take you to do a report?
So I have staff that does the scan, and how we deal with that on a first visit is I have a consultation and brief exam with them, and then my CA takes over from there and does the stress response evaluation. She's really good at it. It's about 15 minutes that it takes her to do it. She's done enough of them. On re-exams, the patient comes into the office, fills out a neurologically based questionnaire on their progress and what's been going on from there. And they get scanned and then come out to get adjusted. As far as educating them on the scans, I don't adjust people on the first visit. There are some exceptions, but for the most part I don't, because I really want time to evaluate what's going on neurologically. So when they come in for their first adjustment, they get a 5-minute overview of the SRE, which if you told me 5 years ago you could do that, I would say you're full of crap. But I do that. They get it enough, and then almost everyone comes to our what we call doctor's report that we do weekly, which I learned at your training from the Gulledges actually years ago. And so started, they know what's wrong with them, but when they come to that class, we go through how neurologically based chiropractic fits into the healthcare model, how it fits into their life, and then go through each variable that we're measuring with it. And as a reward for sitting there for class, everyone that comes to class gets your book. And I can't tell you how many people come back with, and it's all dog-eared, and that educational model of hearing me in the consultation, hearing me on their first adjustment visit, hearing me at doctor's report, and then reading your book has made people really, really understand the concept much better than I ever thought it would be understood before I had a NeuroInfiniti.
Want to share some numbers on PVA?
So my PVA is around 90. I think it's gone over 100 a couple of times. Where I'm pretty sure, I know that I was like at least in a wellness category when I started. And so I was like 45, 50, which is really nothing to sneeze at. But yeah, people totally get it and really understood, because people don't always tell their chiropractor what all of the other things that are going on. And opening that conversation about the brain and the nervous system and using the SRE as the gauge for the conversation, you're going to get so much more information out of them and so many more opportunities to help them with other challenges in their life. And
when you made the shift from the substation, okay, which was a great piece of equipment, a fabulous piece of equipment, because it took us beyond looking at x-rays.
Absolutely.
But when you made that shift from the substation onto the NI, what was that transition like? Did it make much difference in timing, or did you feel that you were getting better communication with the patients with it?
I really did get better communication with the patients with it. It got very difficult to communicate with people because my PVA is pretty good. Um, Once you got through the first re-exam with the substation, the scans didn't really make sense after that. It was really just a snapshot in time of what happened to be going on, and it was very variable on what was happening in their life that day because we weren't measuring their hard wiring. So really, it became very. It really didn't take extra time to perform the scans because I have staff doing it, and what was taking 10 minutes was now taking 15 minutes. But patients frequently just like would nod with a blank stare when I was explaining a substation scan. And I still get that sometimes with an SRE, but there's much more for them to bite into that they understand because of what we get from their brain status and what that means on how they process throughout the day. It's I it really I was shocked because I really expected it to make it much harder to explain things to people, and it immediately made it easier.
Okay, I have two questions to ask that came out of that little conversation.
Okay.
One of them is, okay, how's the post scan on the SRE working with you? With number one, with results, are you seeing the changes in the brain function? And number two, what's the patient response to the post on the SRE?
So for me personally, like it's funny. I teach KST, which is very quantum and not linear. I talk about essential oils around the world, which is very not linear, but I'm extremely left-brained and linear. So for me, when I started to see post scans on SRE, it was awesome because I knew I was getting results, but until I saw the actual scientific basis of the results I was getting, it really it was a linchpin for me in getting what I did, getting the power of what chiropractic is. And I used to say that the old technology was sort of like a patient education tool, but it really wasn't. And this is a much better patient education tool. But not only that, the clinical information that you get from it, and the clinical information that you get from the need to continue care, but also what the patients can do to improve their own skin is huge. Working with them on breathing, on nutrition, on sleep patterns. It's very easy to use the SRE to tie what essential oils they need to use to stimulate their own brain in certain ways and to calm down the stress response. I hope I answered that question, but
Yep, that's the thing that's obvious here, and it's very obvious if people are paying attention to what you've been saying, is that the shift in your PVA is huge.
right.
I mean, you've literally doubled your PVA, and you had a high PVA to begin with. You got to understand that the average PVA in the profession is less than 12 visits, less than 12, and you were running from 45 to up to 90 PVA. That represents a completely different intent for chiropractic care, not only in your office, but in your community. That's huge. So the patient's intent is no longer about back pain or neck pain relief or structural correction. It's all about neurological, and now it's gone beyond neurologic to the concept of what that improvement in the neurological function is doing to their quality of life.
Absolutely.
So congratulations on that, my friend. You're a star, and I know you're a humble man, but you're a star. And beyond that, you are also what I consider to be one of the old-time type chiropractic attitudes, where it was never, I'm against all the other chiropractors. Your heart is including taking care of other chiropractors and nurturing students and bringing them on and helping them out. And I know you very well, and I know that that's where your heart is. And it's just like, I wish there was more Pat Keirans in this world, but believe me.
Thank you.
So I think we pretty much covered this. I just, one question I guess I have left for you today is just, what's your advice to the profession out there?
My advice is to, even though, thank you for your kind things and done what I've done, don't don't take as long to adopt things that you know are right in your heart as I did. You know, Ted Keiran told me for a couple of years to look into NeuroInfiniti before I finally manned up and did it. You know that there's a lot to this brain-based movement that was started by Dr. Barwell, and now everybody's jumping on. If you know in your heart that there's better questions you could be asking of your patient's brain, if there's more information you could get, anything that can get you deeper into innate, and I know most of you have that tug, then you absolutely have to look deeper into the body, and certainly the only way to do that is to look at the brain. And you really need to jump into this movement to move the profession forward and to move yourself forward.
Thank you, my friend. I'm not sure when the next, I know when we're going to see you again. Mm-hmm. We're going to see you in Sweden.
Oh, true, we are. But I just discovered from talking to Dee Dee that I'm going to see you in Orlando at FCC on St. Patrick's Day.
Oh, great. Oh, you're coming down.
She also promised me you were going to have a little keg of green beer under your table.
Okay. All right. I'm looking forward to that. Always fun seeing you. And thank you for your time. And the bottom line is we'll see you somewhere down the road, but we know where that's going to be. So.
Absolutely. Thanks,
all right. Bye for now.
Bye.